Welcome to the Canadian Nurses Association podcast for nurse1.ca's knowledge feature, Staffing, Getting the Right Mix. We're pleased to have Barb Mildon with us, who becomes CNA's president at the end of the biennial convention in June 2012. Hello, Barb. Thanks for joining us.
Hello, I'm happy to be here.
Staffing, or staff mix decision-making, is the process of determining what categories of healthcare provider are needed to deliver care for specific client populations. Barb, why will Canada's nurses be interested in this resource?
Because the resource, named Staff Mix Decision-Making Framework for Quality Nursing Care, offers a comprehensive, credible, and consistent process to guide decision-making about staff mix. It is a collaborative document co-authored by the Canadian Nurses Association, the Canadian Council for Practical Nurse Regulators, and the Registered Psychiatric Nurses of Canada. The document can be accessed from nurse1.ca or the CNA website. Nurses will be interested in the framework because it presents a systematic approach to creating the right mix of direct care staff, specifically nurses and unregulated care provider. It lists the many factors involved in staff mix decisions. With this framework, you can create a mix of staff that meets the needs of the specific client population in your setting and has the potential to optimize outcomes for clients, staff, and the organization. And I'm proud to say that the framework has generated lots of interest and excitement.
So, what is the purpose of the document?
Its purpose is to provide a tool that helps healthcare decision makers consider and answer the questions: how many registered nurses, licensed or registered practical nurses, registered psychiatric nurses, and unregulated healthcare providers do we need in our practice setting? What is the right mix for our client population? Who is the right provider for specific clients?
Okay, so how was the framework developed?
The framework was developed with federal funding from the Government of Canada's Foreign Credential Recognition Program. CNA used this funding to bring together registered nurses, licensed practical nurses, registered psychiatric nurses, and unregulated care providers to update the 2005 version of the framework. Their work was based on a focused literature review and a broad consultation, which included focus groups and surveys.
This does sound like an important resource for nurses and those involved in staff mix decisions. Is it theoretical or is it practical?
It is very practical and designed for real-world application. It is clear, direct, and easy to use. It focuses on the needs of clients, staff, and organizations. It is evidence-informed, and it is applicable to all clinical practice settings. It's also highly flexible and can be adapted for each setting. For example, the list of questions under each component of the nursing process is extensive. Therefore, organizations may elect to use a subset of those questions or develop different questions.
Right, so how does it work?
The framework uses the well-known steps of the nursing process: assess, plan, implement, evaluate. For each step, a series of key questions is provided. The answers to those questions, considered in the context of a review of the setting's key data, such as length of stay, patient safety incidents, and current staff mix, provides practice-based evidence upon which to base and support decisions. Client, staff, and organizational factors and outcomes are then assessed based on guiding principles. These principles are the result of a consultation with nearly 2,300 nurses. One of the principles is that information systems support staff mix decision-making. This means that systematically collected data regarding, for example, length of stay, average age of clients, healthcare needs, patient safety incidents, etc., are considered during the staff mix review and decision-making process.
How are direct care nurses involved in the decision-making process outlined in the framework?
It is essential for direct care nurses and clinical managers to be engaged in the decision-making process. They work most closely with the patients, clients, or residents in their setting. They assess their conditions and healthcare needs. Their expert knowledge needs to inform staff mix decision-making. In fact, one of the 5 guiding principles of the staff mix decision-making framework is for direct care nurses as well as nurse managers to be involved in these decisions.
Is there anything else you'd like to share, Barb?
Yes, and thank you. As a chief nurse executive myself, staffing issues are close to my heart. I'm pleased that the framework and the other supporting resources you will find on the website, including a briefing note template, enable me to use and promote a consistent and comprehensive approach to these decisions. Staff mix issues and nursing care delivery models are high on the agendas of employers, unions, governments, direct care nurses, and unregulated care providers. This framework represents a new tool to guide our efforts. It means that a systematic and transparent process can be used when staff mix decisions are being considered, and thereby promote good outcomes for clients, staff, and organizations. I'm very pleased that this framework was created in collaboration with the Canadian Council for Practical Nurse Regulators and the Registered Psychiatric Nurses of Canada. Our collaboration reflects the real-world clinical settings in which the framework will be used and has enhanced both the comprehensiveness and the credibility of the framework. CNA is very interested in your experience using the framework. Please be in touch with us via email at info@cna-aiic.ca.
That's fantastic, and that's about all the time we have. Barb, thank you very much.
Thank you for having me.
To get all the latest resources on staff mix decision-making, including the staff mix decision-making framework for quality nursing care, visit either nurse1.ca or the CNA website. Thank you for listening.